Good evening. Good evening. Am I audible? I just wanted to check before we have another 3 minutes. Can somebody type if I'm audible? Thank you. I think we have another 2 minutes. We'll wait for the organizers to come in. Thank you for those kind words, Hari. The same here. Okay. Very good evening. I just wish to congratulate the organizer for taking this topic on sleep. In spite of Medical Council of India modifying the syllabus, making it competency-based medical education from this academic year, we still find a very, very small hours or small syllabus which has been brought into as sleep, be it in physiology or be it in medicine. but I find the students to be more keen, interested on sleep. I think it'll be nice because sleep is something each one of us do. Each one of us know what happens if we don't have a good night's sleep. So I'm ready here to answer to your questions. Please ask your questions. I think this session is more of a Q&A session. So it'll be nice if there is good amount of questions from you so that I can answer to your questions. Can I come to the process little later? Let me finish the basics of sleep, then come over. Okay, I've got a question here which says that how many hours of sleep should we have as students? Ideally, the hours of sleep which makes you fresh when you get off the bed is your required sleep time, right? For some, it could be 6, some it could be 8. Ideally, at this age of yours, I'm just taking the age of 17 to 21 or 22. At this age, your sleep duration is roughly around 7 to 9 hours is your required sleep time. Okay, that's your ideal sleep time, 7 to 9 hours. But beyond, if that hours does not make you fresh, that means you have not had good quality of sleep. Remember, more than quantity, it is the quality of sleep. The next thing, there are 3 things. 1 is your quantity. 2 is your quality. 3, it has to be uninterrupted sleep. That is what is called as a good sleep. So the 3 things that determines whether you had a good night's sleep. I'm repeatedly telling it is good night sleep. Okay. So that means you're sleeping in the night. That means your duration should be roughly 7 to 8 hours. When you wake up, you should be really fresh. You should not feel tired. This sleep has to be uninterrupted sleep. Okay. So have all these 3 things in your mind. I have a next question. Why are certain people able to function almost normally even at only 4 hours of sleep while others require 7 hours or so? I think I've answered this question. That is, this we know our Prime Minister, they say that he sleeps hardly for 4 to 5 hours a day. This 4 to 5 hours is a good quality sleep. That is, the sleep is uninterrupted, right? And the sleep, I'm not having any other sleep problems added on with me. Then that hours of sleep is sufficient. But ideally, 7 to 8 hours minimum would be preferred for any age, unless and until I'm old age where I don't have good quality sleep. I can't get into sleep at all. I have another question from Hari Prashant. Is sleeping all the day morning and working night good? This is what most of the IT personnel do, who work across the time zone. Okay? Ideally, I kept telling like your good night's sleep. We sleep in the night. The reason is there are too many biological phenomena which is happening at night. I'm sure you all remember something called a circadian rhythm. There are some hormones, some enzymes which are very, very active during sleep or during the night time, not during the daytime, during the night time. So those things you have to allow it to act. Like for example, melatonin release. Or for another example, some of your hepatic enzymes are very active only in the early morning. Okay? That time you should be sleeping, not active. Only then these enzymes come into operation. So it's ideally better to sleep only in the night. But my work determines me to sleep only in the morning. Then that is your lifestyle. Make your room as dark as possible, give it a night ambience, and then go to sleep. Okay. Do not have any bright light entering your room if you're going to sleep in the morning. That is, I'm telling to shift workers. Students, preferably sleep only in the night, not in the daytime. Okay. I have a question here from Mohammed Haris. It has become a trend that medical students study in the night and sleep during the day during preparation for exam. What do you think about that? It's actually the same question asked in a different perspective of a student. When we sleep, what all happens when we sleep is you have consolidation of memory. What you learned, you are going through them in a different pattern in your sleep. So this makes whatever you learned imprinted into your memory, and you will be able to get it back when you see your question paper. Immediately that answer pops up. Okay, that gives you a very good learning process, good memory, good consolidation. All these things happen during the sleep. Okay, when I said sleep, they have done some research which says that the same question that you have asked, I have my 8 hours of sleep in the morning. I have a group which had 8 hours of sleep in the night. Which is better? They found that the alertness, the cognition, and the decision making was better in the group which slept for the 7 to 8 hours in the night rather than the group which slept for 7 to 8 hours in the morning. Okay? That means there are probably some neurotransmitter or the synaptic formation which happen better during night than during the daytime. Okay. Next question is from Muskan. Does lack of sleep lead to PCOS? Lack of sleep does so much of havoc. Number one havoc is metabolic disorder. When I say metabolic disorder, multiple metabolic disorders happen. Okay, that means your pancreas gets definitely affected. Automatically, you have insulin level getting changed. You definitely go in for PCOS as well. Remember your GnRH secretion, pulsatile secretion, which stimulates your FSH and LH. It's again a circadian clock which stimulates the GnRH production as well. So if you're going to make a mess up with that, your gonadotrophic hormones are also going to get messed up. Could probably, the studies have shown that it is one of the cause for PCOS. It's not the only cause. Okay, so when you treat a PCOS patient, you give multi-pronged approach of treatment, right from weight reduction, diet, physical activity, sleep properly. Okay, so everything comes into it. Renuka, your question is, since sleep has so many benefits, can we say that oversleeping is beneficial? Very good question. I'm sure you know one more thing. Anything though good at an overdose is not good, right? So sleep is also in the same thing. Overdose of sleep definitely is not good because when you sleep over, you have your leptin ghrelin imbalance setting in, sympathetic parasympathetic imbalance setting in. So probably will make you go in for obesity and other metabolic derangements. So better to have at least 7 to 8 hours of, let's say you need 9 hours of sleep to feel fresh. Please take that 9 hours, but don't oversleep too much. Okay. I have a question from Nitin. I've heard that people sleeping with ambient sounds such as white noise playing throughout the night. Does it affect sleep significantly? I'm not sure how many of you are familiar with Kamal's movie Pesum Padam. That's a movie where his room is very close to a movie theater. So he always gets that movie sound. And when he goes to a hotel to sleep, he doesn't get the sleep. So he records the movie sound from that place and then keeps it in his room for sleeping, right? So sometimes you get used to some noise when you're sleeping. Otherwise, you have an eerie feel that you don't get the sleep. But it is ideal your sound is of a soft nature, not the white noise kind of sound. You have some melodious music which can be played, which promotes sleep. Okay. Um, some people who know classical music who can understand that there are some raga which make you go in for sleep, like for example Neelambari, Sahana. These are all the ragas which are used for making lullabies also. So they put you to sleep. That sort of a thing helps you to go for a sleep better rather than a white noise. White noise has a complete range, all the frequencies are there in it. Anushri, ma'am, is it good to split my sleep like 6 hours at night and remaining half hour at some other daytime? No. If let's take you have the luxury of only 6 hours of sleep time for sleep, please sleep. Then in that case, what they say is if you can take it as a power nap, okay? Your lunch break is for 45 minutes. Have your lunch in 15 minutes, at 30 minutes, have a good sleep. You will really feel fresh for the post lunch time. So this power nap actually helps. I don't know how many of you are aware. When I was a school kid, we used to have a sleep hour in our timetable. The blanket would be put across and all of us will be sleeping. After that, we wake up, have to go to a washroom, wash our face and come back to our class. We are fresh. After that, it's mostly a max class or something like that. Okay. So that power nap actually helps. Okay. I think a number of Japanese companies actually have this power nap for them. I don't know whether we have the luxury. So the 45 minutes lunch break, let's take that. 15 minutes lunch, 30 minutes have your break. Don't do the vice versa. Half an hour sleep, then take your lunch. That might affect it. Okay. I have a question from Shalini Christopher. Why do we snore during sleep? I think that's a nice question. There are a number of causes why we snore. The first thing that we should remember that when we breathe in, air enters the nasal cavity, goes through your pharynx, okay, your trachea, and then into your lungs. The entire passage, apart from starting with trachea, is only spaces. You have some organ, some part, like it could be tonsillar pillar, it could be your uvula, something is there, or posterior pharyngeal wall. Now the gap, the space is formed by number of structures. So anything that can block the space, okay, the airway gets narrowed. That's the first point. Number two, when we breathe in, it's an active process. So this entire spaces opens up and we breathe in the air. But when we breathe out, it's a passive process. At that time, when this airway gets narrowed, the same air which could go through this pathway now goes through this narrowed pathway. Okay, it's like your flute. You close the holes. When you open the hole, through that hole only this air is going to come out. When it is going to come out, it makes the sound. It's the same thing that happens is snoring. My airway is getting narrowed. So when the air is coming out, it comes out with that sound, which you feel as snoring. What all could be the cause? Your nasal septum, something blocking in your nasal cavity, your adenoids are enlarged, or your tonsillar pillars have got enlarged. So these things will occlude your airway. Even your thick tongue, when we sleep, it falls back. That again narrows our airway. So these things cause you to snore. Clear? This I've just put it as anatomical structures which could make you to snore. This is one of it, but there are multiple causes which make you to snore as well. Okay. I have another question from Hari Prashant. People, some of age above 50, prefer sleeping drugs. Can they be reduced by any other physical method? Very much. Try avoiding taking pills to go to sleep. Right? There are a number of things which promote sleep. Number one, Do not have anything to eat 2 hours before you go to sleep. That means my dinner, if I'm going to sleep at 10 o'clock, my dinner should be at 8 p.m., not later than that. That is 2 hours. I'm giving a gap between my last food and my sleep. Do not take anything that is a stimulant, be it a coffee, tea, or a cigarette or anything. Do not get exposed to any light emitting device. When I say light emitting device, it starts from your mobile phone to laptop to your iPad to your TV screen. 45 minutes before you sleep, all these light devices should be off, right? No vigorous physical activity before you sleep. You can have a moonwalk. Just a gentle walk is sufficient. It's just a romantic sort of a walk. Walk as slowly as possible. That breeze comes in. Okay. Have your room at an ambient temperature of 26 degrees. That's preferred. Okay. Don't go too cold. Don't go too warm as well. 26 is ideal temperature. Do not have any light in your bedroom. I'm saying no bright light because you said about old people, there could be a dim blue color light. That's sufficient. No other light. No harsh sound before you go to sleep. Okay. No violent movies or any thriller or Thodarum kind of a serial before you go to a movie. Go to your bed. Okay. A glass of warm milk promotes sleep. There are some food items which promote sleep as well, and there are some food items which you should avoid before you go to sleep. Spicy food, oily food, anything with too much of masala and other things, avoid before you go to bed. Okay, that's your supper. Don't take them in your supper. Clear? Have a glass of warm milk. If you're not able to sleep, I would just suggest a pleasant music in the room, a glass of warm milk, light clothing, no too tight a clothing, a light clothing would be sufficient. Okay. The next thing is there are some sleep enhancers which are our own food items. In Tamil, we call it gasagasa or couscous. Okay. That helps in sleep. Soak it in water, grind it, add it in the milk that you're taking, it promotes sleep. Honey promotes sleep. Certain things like this promote sleep. I think that would be better rather than taking any pills to go to sleep. Okay. I have a question from Anisha Wilson. Often, even though some of us go to bed without having had any coffee or anything that might keep us up at night, even then we wake up at two or three times between. Okay. I'll tell you two things. Number one, the position in which you're lying to sleep. Check that. Sometimes you keep your hand below your head and sleep. When you sleep like that, you're putting a strain both on your palm and on your elbow. That pains, and you have to turn to the other side. So have a comfortable sleep posture that makes you go for a better sleep. That's one thing. I just said I'm just not going into any pathological condition. I'm just telling your lifestyle modification. A comfortable bedding and pillow. You have kept your AC at 26, not at 18 or 16. Okay. So you don't need a blanket or other things. You don't need to go switch off the AC or switch off the fan that it is too cold, which wakes you up. Okay. Number two, what was it that you did before you went to bed? You have a half-finished job. Let's take you have to submit your assignment or your record and you have not done it. I have to wake up tomorrow early morning by 4 o'clock to finish it. Even if you set your alarm at 4 o'clock, don't sleep with an unfinished job. Clear? That's number two. Number three, did you take too much of fluid before you went to bed? I would say the best alarm is I want to wake up in 6 hours from the time I went to bed. The best thing is have 250 ml of plain water, go to bed. You don't need an alarm. You don't need anybody to wake you up. Your bladder will wake you up, right? So that's one of the most common cause why we wake up in our sleep. I hope you don't have any night tremors, your terror attacks. You don't have a restless leg syndrome. You don't have obstructive sleep apnea. Okay. You are having any of these sleep disorders, again you have these wake up in between your sleep. Okay. I'm thinking, I'm I'm talking about healthy people who are waking up in between. Am I right, Anisha? Healthy people, these could be the reason why you wake up. Okay. I have a question from Subiksha. Looking into mobile and some of the gadgets till the minute we sleep has become our routine. Has become our, where is the how to avoid it and how does it affect? Most important thing, do not charge your mobile phone in your bedroom. You are not somebody in the army, somebody in the ministry, you're not a doctor who gets an emergency call. Better keep your mobile phone away from you. Please don't give an excuse that that's where I set my alarm, so I keep it right next to me. No, don't keep it. Use the regular clock that we have. We switch it off when we want to shut off the alarm. Use that. That's better. That made us sleep better. That made us trust the alarm better. Now we don't trust the mobile phone alarm at all. We wake up so many times in spite of it. We have an alarm. We have a snooze as well in the alarm. So we get up only to put off the snooze. We don't do anything beyond that with our mobile phone, right? So do not keep your mobile phone right next to you. I would suggest for everybody, be it a student or be it an adult, everybody, please give a mobile phone a specific time. Let everybody know that beyond 9 o'clock, everybody knows regarding me. Beyond 9:30, you send any SMS to Matangi, you will not get a reply till 5 a.m. next day. Because beyond 9:30, I don't reply to any of the SMS at all. Let people know about it. Don't see it. Okay. Make that. These are some of the small lifestyle modification which we need to make ourselves better. Let's try that slowly. Okay. If you see that in the West, it's only in India that people say, when did she see the mobile phone last time? When was she live online on the WhatsApp? All those things. Okay. If you have not replied, in the West, they do not reply for any of your official WhatsApp beyond the official time. They do not reply to any of your official mail beyond the official time. Why not we keep it like that? Right? Keep it like that. That would be better. Okay. I have a question from VR. Main hormones that are involved in sleep. The first hormone which should definitely not be there, I will tell that it's your cortisol. Okay. Your cortisol level spikes whenever you're stressed. Please have it at a lower level. If you see your spike of your cortisol, it spikes only twice in your day. 8 a.m. in the morning, closer to 6 p.m. in the evening. That's your circadian rhythm for cortisol. Don't make it go up at 9 or 10 p.m. in the night. It's going to affect your sleep. No stress. No call with your friend, fight, and then go to sleep. Okay. Avoid increasing your cortisol level. The most important hormone which promotes you to sleep is melatonin. Okay. And for you to have melatonin, please dim your light. Right? You dim your light, automatically you have melatonin. There are some food which are rich in melatonin. That's why I said warm milk, gasakasa, and other things. These enhance your melatonin production as well. Okay? Even if you see jet lag, where your sleep cycle has got disrupted, one of the treatment option is melatonin. Okay. Sibi, ma'am, it is said that Leonardo da Vinci followed a polyphasic sleep pattern to increase his productivity. Is such a thing even possible or advisable? Remember, all of us had a polycyclic sleep habit. That's the ontogeny of sleep in human. As a kid, we wake up, have the milk, do our jobs, everything, 1 or 2, do our job, then go back to sleep. We wake up, again have the milk, play something or giggle something and do our job and then go back to sleep. So we were awake, sleepy, awake, sleepy, awake, sleepy. So we had a polycyclic sleep only when we were a kid. This polycyclic sleep slowly became as thrice a day. Then it became twice a day. Then it has become once a day, right? Can I go back to that? If you have the luxury of it, please do it. It's like I'm awake in anatomy class, I'm sleepy in physiology class, I'm awake in biochemistry class, I'm sleepy in the lunch break, I'm awake in the practical class, I'm sleepy in the tutorial class. Have this cycle and see what happens. Unfortunately, we don't have that luxury of it. And if you do that only on the weekends, you're disrupting your sleep cycle. Unfortunately, we don't have the luxury of Leonardo da Vinci, of that polyphasic sleep. Okay. Madan, tell us about lack of sleep. It's a beautiful question. When I say lack of sleep, I will go in for sleep deprivation, right? When I say lack of sleep is I need 8 hours of sleep for me to feel fresh when I get off the bed. If I have less than 8 hours of sleep, that's called as lack of sleep. Okay. That means when I wake up, I'm not as fresh as I would have been if I had that 8 hours of sleep. Now, this lack of sleep, the first thing that it does is early morning, just say think for yourself. How are you? You're irritated. You scream for even the smallest thing. You lose your temper like anything. Okay? You cannot focus on anything. You can't remember anything. As a student, all these things are a deterrent for you. So these things will make you increase your number of errors. Your cognition gets affected. Okay. So now when all these things get affected, not only your errors, your chance of getting in for accidents also go up. If you see many of the major disasters that have happened, they were man-made disaster because of somebody who had sleep deprivation. And he could not control his sleep and he had a sleep rebound, overslept, and he did not do his job properly. So there was an accident. Okay. So these are all something that is a warning to tell you, please sleep more. You don't have enough sleep. You're not taking this warning. You're still following your routine only. You are putting always yourself into that lack of good sleep. It is something like my debt keeps increasing. My sleep debt keeps increasing. The sleep debt, today it is 1 hour less sleep. Tomorrow, for me to repay it, I will have to repay it by 1.5 hours. I'm sure you would have seen it yourself. Okay? The day you have burnt your midnight candle for studying for a test, the next day you will oversleep because it is like an interest repay worse than a bank. It is not an 8% interest. It is almost 30 to 40% interest. 1 hour of sleep debt, you repay by 1.5 hours of extra sleep the next day. If you delay it further, you will keep adding. It is not arithmetic, it is geometric increase, right? Even now, you are not correcting yourself. Complete metabolism gets affected. Number of hormones gets deranged, right from your cortisol. I'm sure you know each of your hormones are interlinked. Your gonadotrophic hormone, your thyroid hormone, your pancreatic hormone, everything is getting affected. I'm sure you know what is the role of each of these hormones in the metabolism. Now this takes you further. You have still not corrected. Your blood sugar goes up. Your lipid profile goes in for a toss. Okay. So when your blood sugar goes up, even now you're not correcting it, you are going to become a diabetic. Still you're not correcting. My blood sugar has gone up. My lipid profile has gone up. I've gone for a toss. It's no good now. I'm going in for a next disorder called as my syndrome Z. A complete derangement has happened. I'm going for the rich man's disease. I go in for my coronary artery disease as well. These things are the things that you see. The one of the important cause why you see death now in a healthy adult at the age of 45 or so. Hypertension is something that you see even before diabetes onset is seen. Okay, so you are your own master. You are your own enemy. You have made the flaw, so correct your flaw. Okay. So now these things, when I said your cognition and other thing gets affected, automatically your interpersonal relationship also gets affected, and it becomes a positive vicious cycle now, putting you into more and more trouble. Okay. I have another question from Farzwal. Why is it that some people can't get sleep at night? It is how you train it. It's your mind, your brain, your body. How did you train it? Did you train it properly? Did you keep burning your midnight candle for studying? Did you keep playing video games? Did you keep being on the social media, chatting and other things, foregoing your sleep? If you have done it, you correct these problems, right? These are in your hand, you can correct it. The other way around, I am not getting the sleep at night, but I am drowsy in the morning. This is some organic problem. There are a number of sleep disorders. Check what sleep disorder it is. Okay, correct that. You will see another case with your grandparents. They will say that whole night I have been awake. I could not sleep at all. Just watch what they are doing in the weekends. They would be taking short naps throughout the daytime. Even the TV would be on. They would be right in front of the TV with the eyes closed and even snoring. Okay. So in those cases, they cannot get the sleep in the night. Right? The only thing that you cannot do is do a polysomnographic study to find out what is the underlying problem in this person, why he could not sleep. Okay. It's not something to scare. There are some of the neurological conditions which affect sleep. There are number of disorders which affect sleep. Just go and see your medicine book. It says there is one table which shows that these are diseases where sleep is compromised. Okay. So in those conditions, again, they cannot sleep in the night. Let's say if there is severe pain, they cannot sleep. The pain could be anything, so as simple as a toothache to a knee pain or anything. Address the underlying cause so that the sleep can be corrected. So Diksha, how to manage time to sleep during exams? I'm really a tough teacher and a worse mother. I always say sleep in the night, study early in the morning. Okay? You actually study better in the early morning. You can say I'm a night owl. No, everybody can modify it. Okay, that's one. Try it, it'll be better. Number two, what makes you not to sleep before your exam? Is it that volume that is at your hand to study? That means break your volume. Keep studying right before the day of weeks of the exam so that the previous night, please sleep nicely. Don't compromise on your sleep. As much as good sleep you have, so much of your memory is better. You can get the answers in a jiffy because it's like, remember, your memory is just like your computer memory only. It has gone into number of files, number of folders. I just put one keyword in my computer in my search. Does it not pick it from all the drives D, E, F in your hard disk from everywhere? Let's take, I'm putting a keyword as sleep. In every folder that sleep might be there, it would have picked up everything and shown it. That's the same capacity your brain has. But if it has to pick everything, let's take some topic which was taught in the first year, in the pharmacology in the second year, or in medicine, you want to answer now in the medicine paper. How can you bring what you studied 3 years back or your 4 years back? It's possible only if it has gone consolidated into your memory and you retrieve it properly when you want. But for doing that, your sleep should not have been compromised the previous day. If you do not want your sleep to be compromised, you should have studied before itself. So plan. வடிவேல் சொல்ற மாதிரி தான் எல்லாம் பிளான் பண்ணி பண்ணணும். Okay, you know your exam is going to be on the 1st of July. Please, today is 18th of June. Break your chunk that you have to study so that on 30th of June, even if there is no power cut, you can sleep nicely and go write your exams very well. Okay, try that. Don't take coffee to keep awake. You will definitely not be able to sleep. Okay. Next thing that children do is have lot of these mentors. Please don't do it. They actually suppress your neuronal activities. They keep you alert, but your neural transmission is affected. It affects with your memory process. So please don't do that. Okay. Rohini, no, ma'am. What could be the reason to have multiple interruptions during sleep? How can one prevent it from happening? I think I've answered it in for a different question. Just think, why are you having these interruptions? Is it suddenly you jump up because you thought of something that you missed up in your record, or you missed studying? Okay. Or you suddenly got up thinking, I should not forget this tomorrow. Okay. Or is it suddenly you got up because of something physiologically, like in sleep apnea? That less oxygen makes you wake up. If it had not woken you up, you would have been dead in your sleep itself. That apnea and hypopnea makes you wake up. Okay. If that is the cause, correct your sleep apnea. Is it restless leg syndrome? That actually makes people wake up. Some people get that cramps when they are sleeping. Remember, one of the cause for your cramp is your electrolyte imbalance. Some old people definitely have these cramps. As simple as banana could be sufficient. Good amount of fluid intake, that too in this summer. Dehydration is one of the cause for our electrolyte and fluid imbalance. So have enough water and other things so that you don't have a cramp which makes you wake up from your sleep. So this sort of a thing can also make you wake up from your sleep. And I find now the youngsters, one of the most important interruption in your sleep is the beep from your mobile phone. Please keep your mobile phone away from your bedroom. If it has to be inside your bedroom and you're a hostelite, that's the only luxurious room I have. Please keep it in silent mode. Okay. Don't keep it in vibration mode, because at that silent wee hours, even that vibration makes us wake up. Okay. So that is one of the causes. These are some of the simplest causes which makes us have sleep interruption. Okay. One of the causes can even be your bladder. One another cause could be acidity. That depends on the type of food that you took before you slept. Okay, I've already said at least have the 2 hours gap between your dinner and your time of bed. Vaishalini, why do we get good dream and a bad dream, bad nightmare during sleep? Okay, it's good that you have dream in the night. You're not dreaming when you're awake. Okay, the dreams that you get, there are two types of dreams that you get. One, I have an exam tomorrow. You will see, you will have a nightmare that day that you are writing your exam. You didn't flip the other side of your question paper. You realize it when you come out and your friends say that, did you write this question? What did you write? That's the time you realize that, was there another set of questions on the other side of the paper? You wake up. Okay. This is one of the cause for waking up. Somebody asked me now, why do we wake up suddenly in the sleep? These nightmares wake up. Okay. These are certain things in our subconscious mind which makes us get so many dreams. I had my professor who used to say, have a notebook and a pen next to your bed, because sleep is the time when you have erratic thoughts and wonderful solutions for a problem that you have. Okay, because that's the time your brain is in the calmest state. It goes into the subconscious level, and you start to think so many things at the subconscious level, which works and comes out with the most plausible answer for the problems that you're facing. Okay, so that's one of the good things that can happen in your dreams, right? The next thing, these nightmares that you get during the sleep could be a reflection of what did you see before you went to bed. What was the discussion that you had before you went to bed? What did you read before you went to bed? These things go into a subconscious and come out as our dreams as well. Okay. Dreams are something that you cannot say that how can I avoid dreams? You cannot avoid dreams. Only thing is that if it's a nightmare like this, avoid seeing all these things before you go to your dream. Okay. I don't know who is this toothpaste. Anyway, good morning. When I see a toothpaste in a sleep thing, I find it saying good morning. I sleep at 1 a.m. and wake up at 8 a.m., but I don't feel like I slept and feel tired. There is a time for everything. Can you just shift it 2 hours, right? Instead of 1 a.m., can you sleep at 11 p.m.? And instead of wake up at 8 a.m., can you wake up at 7 a.m.? I'm just shifted it. I've just given you 1 more hour addition of sleep. Just try that, okay? Because your melatonin level is very, very important. And at this time, you are making it go in for a toss. If you're going to go to bed at 1 a.m., that means your room light was on till 12:59 a.m., right? So your melatonin level is going to not be at the normal level to promote your sleep. The next thing, what time did you have your dinner? 8 p.m. And 1 a.m. you're awake. You'll be hungry. You can't get your sleep at all. So your entire sleep from 1 a.m. to 8 a.m., you would have I would not say an interrupted sleep, not a good sleep. Our sleep has two phases. I'm sure you remember your physiology class, your NREM and REM stage of sleep, right? This goes in for a cycle, at least 90 minutes each cycle, with your REM stage of sleep starting for 5 to 10 minutes in the first cycle and in the last cycle becoming more. Okay, so the REM comes at the end of your every cycle for 5 to 10 minutes, and when you wake up, you normally wake up in your REM. Okay, so this cycle has to be there, at least 5 to 6 cycles have to be there when you're sleeping. With more of NREM, not REM. In this 1 a.m. to 8 a.m. that you're having, what is your sleep hypnogram or your sleep architecture? Okay? Your sleep architecture, you should have spent enough of time in your N3 and N4 stage of your sleep. If you had spent your time in this stage of your sleep or your stage 3 of your sleep, only then you will feel refreshed. Okay, remember, in your REM stage of sleep, your brain is very, very alert. Your EEG rhythm is like you're awake. Beta rhythm is what you see. And if your entire sleep is in your REM predominantly, that means your brain has been alert. How do you expect you to be relaxed? You will not feel fresh at all. You will feel tired because your brain was working, because it was in REM. Okay, so try to have more of NREM stage of sleep. So sleep in the night, okay, at least 11. Okay, slowly shift that to 10:45. 10:30, go to bed. I know it's difficult to ask a college student to sleep at 10:30, but that would be ideal. Okay, Archana, ma'am, does lack of sleep or oversleeping affect our thyroid level? It does. And it is also vice versa. I am a hypothyroid. I am more sleepy. I am a hyperthyroid. My neuronal activity is very high and have sleep disturbance. Right? Number 2, If my sleep is affected, I already said every endocrine gland function gets affected. Okay. If you in fact see in our Indian system of medicine, be it Ayurveda, Siddha, Unani, or anything, earlier they used to ask a patient when they come to them, the doctor used to ask, do you eat well? How much water do you drink every day? Are your bowel movements normal? Do you feel hungry? How is your sleep? Now, unfortunately, the sleep is not being asked in our modern system of medicine. Sleep impacts every organ function. I'm sure you know, when you have had a very bad sleep, your back aches. You can't write as much as you can. You can't talk fluently. You can't think better. You will feel tired. You will feel breathless. You will feel extremely tired that you anemic. That sort of a condition will also be there. Keep having it longer, you might be diabetic. How many doctors ask a diabetic, do you sleep properly? Let's start to ask it from your gen doctors, right? Sleep affects every gland, every organ in our body, right? I'll ask you a simple thing. In the morning, in your wake time, when you're awake, how many times do you use your restroom to empty your bladder? The same thing, 8 hours of sleep. You're not waking up to empty your bladder at all. What happened to the kidney? It also took some rest, right? Give every organ the required rest. You gave the rest for your stomach. You gave the rest for your intestine to just move and absorb. Send everything to your large intestine. Wait there till I wake up for my gastrocolic reflex to defecate, right? Every organ needs that rest, right? Have a good sleep. In fact, good sleep, good aging was one of the theme for World Sleep Day, right? Be healthy, so you have to sleep good. I have a question from Anisha. I have another question. Does having a power nap for maybe 20 minutes during the day before doing a continuing task? If so, do we actually sleep in 20 minutes? Yes, you sleep. It is actually very good sleep. But I don't know if you have the luxury for it. That's what I said. Sometimes have you felt like that small 20 minutes nap, after that you feel really fresh, right? Oh my God, I felt like I slept for long. It was so good, slept nicely, right? It's not that just slept nicely. Your brain calmed down. Your reticular activating system did not fire its signals to your cortex. That's sufficient to keep you ready for the next firing signals. Okay, so try that. It's actually good. I have a question. How to normalize sleep after hitting insomnia for the past 1 year and overcome interrupted sleep? Number one, do good physical activity. When you do physical activity, even without your knowledge, you will fall asleep. Right? This was a question from Vishwa. Please go to your gym. 6 o'clock. Go to your gym. Do nice workout. Come back by 6:45 or so. 7:30 or 8. Have your dinner. Just take some book. Whichever book puts you to sleep. It can be even your physiology book. Take that. You will fall asleep because you're physically drained out. You will fall asleep. Easiest way that you can try at your age to fall asleep, right? I'm not giving you anything to fall asleep. Good physical activity. When you're doing this, you have not had a power nap. You did not sleep any time in the daytime, right? Only then this physical activity will make you go for good sleep. Okay. Number two, avoid all the stimulants that I have said. Every sense organ, try to shut it off. Okay, the sense organ could be the food that you eat, watch it out. Eyes, what do you see? Ears, what do you hear? Okay, Your skin, what temperature is falling on it? Is my bed a comfortable bed? Is my room ambient temperature right? Is my room light right? Make all these things to fit in for how your night room has to be. Be in your pajamas or your nighties so that you're relaxed, light clothing, and go to bed. Okay. Still, you're not getting sleep. Have a glass of warm milk. That actually promotes your sleep as well. Okay. Try all these things. They are not medicines. Okay. Try all these things. Just a small life. You're tweaking your lifestyle for better life. Just do that so that you can sleep better. Okay. Definitely no mobile phone. Avoid your screen time 45 minutes before you hit the bed. Remember, your bed is only for sleeping. Sometimes they say that my bed invites me to sleep. Don't make your bed as your study table. Don't make your bed as your dining table. Make your bed only for sleep, right? Use it only for sleeping. So as soon as you go there, it will be inviting. I love you, you love me. Bed and pillow loves you so much. You will get a good sleep. Try that out. Okay. Rohin Sanatan, what effects do psychedelics have on the brain during sleep? Most of it acts at neurotransmitter levels. Right? There are neurotransmitters which promote your sleep. There are neurotransmitter which keeps you awake. That balance is what is being used by most of these psychiatrists when they are treating a patient. Okay? Keep them quiet so that they go to sleep. Right? So that sort of a thing you can just try that. But I don't advise anybody to take any pills to sleep unless and until you are 80 plus, where your sleep is compromised. Okay. Subiksha, which is the best position to sleep? There are two theories which say which is the best position to sleep. But more than that, what is your bedding? Is it on the floor that I'm sleeping? Is it on the coir mat that I'm sleeping? Is it that foam mattress I'm sleeping? Is it the spring mattress I'm sleeping? Your body posture changes depending on your bedding, right? If my bedding is a hard bedding, the preferred position is lateral. There are some who say when you go to bed, that is 2 hours after your dinner, it is left lateral position is better because you're not going to compromise anything to your liver blood flow, right? This is one theory which says left lateral is better. I'm having a contour bed. These contour beds, you're not supposed to sleep on the lateral side. You're supposed to sleep supine because the contour is made for your supine. So that this is something which is being advised for many of the IT professionals. Have a contour bed. Sleep supine because your spine, which has been on an erect posture, has got strained so much so that you're giving the relaxed position. Okay. But in any other mattress, I would only say lateral position. Keep switching your lateral to spine to the left lateral or right lateral posture. Right? This is one. Number two, I am having a big tummy. Right? I'm obese. Any side that I sleep, it will be very, very difficult. The only thing that will help me is sleeping on my tummy. Right? Because in that way, I have given enough room for my diaphragm to come down to breathe. Okay, so that's another thing. I'm having severe cold or obstruction on my nasal. So sleep in an inclined posture like this. Keep a couple of pillow, one pillow like this, one pillow like this, and sleep. Have that slant of 20 to 30 degrees. This makes your lungs come down, your diaphragm come down, and the air entering into your lung is better. This is something that we tell even for children who have cold. A kid who has cold, we tell them, put it like this. The other way, put him on you and then make him sleep. Because automatically it gets that inclined posture, that kangaroo type of a thing. the kangaroo mother thing, put the child over you so that the child has that slant like this and he can have breathing properly, okay, with the tummy on you. Okay, so the breathing becomes normal, but the face on the side. Okay. I have a question from Aishwarya. How can the time needed to fall asleep be shortened? This, are you asking because you oversleep? If you oversleep, watch your quality of sleep. Your quantity is more, but your quality is not good. Check your quality of sleep. See that you spend more time in NREM sleep, not in your REM sleep. Check that your sleep is not interrupted too much, be it noise, be it light, or be it even dreams, or any physiological bio breaks or anything. Okay? Then your sleep, what you get is ideal. Number two, I oversleep. Then the first thing that I said, make your bladder wake you up. Okay? Have a glass of water depending on what time you want to wake up. I want to wake up 6 hours from the time I hit the bed. 250 ml of water is preferred. I want to get up 8 hours after I hit the bed. Have 150 ml of water. You will wake up 8 hours after. Definitely. Right? So this is one. This is the second one. Number three, have somebody to wake you up. Number one, never keep your alarm at your arm's distance. Keep your alarm in such a way that you will have to wake up to switch off the alarm, right? Remove the snooze option from your alarm and have your alarm tone as the most annoying tone. Remember, we get adapted to every sound. You're going to have the same alarm tone also. You will not even hear that alarm ringing. So the best thing is have your alarm tone as an annoying alarm tone. You wake up. Or have a wake up buddy. The best wake up buddy is your mother. You tell your mother to give you a wake up call. She will give you a wake up call till you wake up. Or she will see to it that she calls your roommate or calls your friend so that you're awake. Try that. You will wake up properly. These are simplest things that can wake you up. I'm not going to anything that can wake you up. No drug, nothing. Okay? Physiological. Hari Prashant. Relation between dream and sleep. We dream during REM and NREM sleep. But fortunately, we remember the sleep in our dream in our REM sleep to a certain extent. There is no consolidation of dream happening in our NREM sleep or the slow wave sleep. Okay? Now, what are these dreams? The research on it is going like anything, but still the answer is not clear. But one thing is, what is there in your subconscious mind comes out as your dream. Let's take you wanted to slap somebody. You could not do it when you're awake. You will do it in your dream, right? It's like you become the hero in your dream when you try to enact so many things that are there in your subconscious mind. So those are your dreams. Okay. Laptops, ma'am. Laptops are equally something that gives you bright light. Laptop, iPad, mobile phone, or TV screen. Don't say that I use a blue screen. I have reduced my brightness as much as possible. No. The lowest level of brightness in your mobile phone still triggers almost 70% of your neurons active. Then how do you get to sleep? Please keep them at their lowest ebb before you go to sleep. Madhivanan is the meditation has a significant role in sleep. I'll put it the other way around. Some people, when they sit for meditation, sleep off. Because when you try to meditate, the one thing that you're trying to do is the brain that was going in multiple directions, you have tried to bring it towards only one pointed focus. It could be image of a god, it could be your breathing, it could be a chanting of a name, it could be something on which you want to focus. The minute you have got your attention to a single pointed focus, not multiple neurons are active. Okay, the brain becomes calm, and it's no more sympathetic activity, it is parasympathetic activity. This balance, shifting from sympathetic to parasympathetic, brings so much of calmness, reduced activity in every cell of your body. Remember, parasympathetic activity reduces your metabolism throughout your body, except your GI tract. Okay? Throughout your body, metabolism is reduced by parasympathetic nervous system. So automatically everything calms down. Okay. So when you have made your brain enjoy the calmness, automatically when you people who meditate can have the parasympathetic activity enhanced and sleep quality to be better. Okay. So Madhumita, I used to get dreams daily. Are they the same dream or are they continuity of the dreams? Sometimes enjoy the dreams. I'm just telling it on a lighter note. Okay. Sometimes enjoy a dream. Other way around, if it is something which was scary, something which you have faced when you were young, that dream keeps coming. That keeps coming in your dream every day. Then you definitely need a help of a psychologist. Please meet I'm not telling a psychiatrist, it's a psychologist. Okay, because the way you think has to be slightly modified for you to see the one that you wanted to forget. You're not able to forget, you're not able to let go of that. It is still there in your subconscious and coming out when you're in your sleep. So take care of that a lot if it is something which was a traumatic situation. I tell you, number of children who have seen a live accident, an accident live, okay? They have seen a death of something live. They cannot sleep for some time. They get up with a night terror. So they have to have that counseling to go on to let go of that terror that they have seen so that that is gone from the subconscious mind and then they get to sleep again. Okay, without that coming in the dream. Sneha, is sleeping a vicious cycle? I will not say a vicious cycle, but onset of sleep is one of the positive feedback mechanism, right? That's why I said completely shut down all your senses, because I want one to promote another, another to promote another. So you have to make one neuron which is sleeping to keep all your millions of neurons to sleep. That's a positive feedback. Okay. Sleep cycle, the hypnogram that I said, you going in from slow wave sleep to REM sleep, again to your N2, N3, N4 REM, coming to N1, N2, N3 to REM. So this cyclical thing, it is not a fixed pattern. Okay, if you record your entire sleep and then plot the hypnogram, you will see the cyclic pattern going from N1, N2, N3, REM. Again coming down to N2, N3, REM. Again coming down to N1, N2, N3, N4 REM. You can keep going on like this in your sleep. That is what we call as a sleep cycle. But it's not a vicious cycle. Okay? Because I sleep 8 to 9 hours at night, then I feel more sleepy the whole day. But if I sleep 5 to 6 hours, I feel tired. Okay? Now this is what I said. Check the interruptions and quality of your sleep. In which phase of sleep were you in? To know that it's only a overnight sleep study you need. Otherwise, something that you need to look into is all those things that I said. What time was your dinner? What was your physical activity that you did? How long before you went to bed you did? What type of dinner that you had? What's your room setup for sleeping? All these things, take it into consideration. Have a good quality of sleep. Okay. Madhumita, sometimes dreams wake me up. I'm so disturbed. Now that's what I said, Madhu. What type of dreams are they? Right? It's like every time It's the Viva. I'm sitting in the Viva and I'm not able to get any answer. That could be a terror attack for you. Why did you not answer your Viva? Try giving a Viva with one of the faculty with whom you're very, very friendly. I've studied this one. Can you ask me questions on this topic? Try doing something like this so that Viva terror can go off. See what is your terror which is disturbing you. If it's the same thing that is disturbing you, try to consciously negate that thought from your mind. Okay? Nitin, blue light blocking lens are available. This is exactly what I said. I have a blue light cancellation on my computer. Can I use it? Please don't use any of these stimulants. Okay? These are the other way that people have made us be on these gadgets a lot, but that is making us our sleep getting compromised. Just see how many of you have your Fitbit. Configure it on your mobile and see. There is a study, I'm sure you know, from your Fitbit, you have given a license to, you have given permission to somebody to use your data, and they have found that Indians, 83% of Indians are sleep deprived. Right? You're one among the 83. If you're having a good sleep, you're one among the 17%. Okay? So please avoid using these gadgets. Rama Bharati, why do elderly people, like people above 40 years, Rama Bharati, this is offending. People above 40 years are elderly people. Life begins at 40 years. People above 40 years get sleeping issues. And despite taking sleeping pills, some people don't get proper sleep at night. That's exactly what I said. Number one, there are too many things worrying you. Number two, you are having small naps at the daytime, right? Which you are really not consciously taking, but you have those snaps. Okay, then take care of those things. Number three, there are so many diseases which compromise sleep, both quality and quantity. Have those diseases been addressed to? If not, they will have to be addressed, right? Anushri, how many days should I follow a particular sleep time pattern so that it becomes my routine? Sleep is beautiful. You don't need the 21 days. You just need 4 days. 96 hours. If you practice a proper sleep hygiene, you will get into that pattern very fast. Right? Just 96 hours. 4 days. Follow the same sleep pattern. Fifth day, you will automatically hit the bed at the same time. You will wake up at the same time. Don't have any cheat days. Today is Sunday. Can I sleep late? Can I wake up late? Again, your sleep cycle is in for a toss, right? Every day is the same day for sleep. Mohammed Haris, how much do you attribute a good night's sleep to weight loss in people trying to reduce their weight? Fantastic question. You have hormones which promote your sleep. What are the hormones that promote your eating and eating? What are the hormones that promote your sleep? Just think it over. Hormones that promote your sleep, your leptin and your ghrelin. These hormones change when you sleep, right? So sleep at appropriate time. Have a good sleep, good depth, good duration, no fragmentation. Then your leptin and ghrelin levels, your satiety will be there, your hunger the hormone is not going to be there, so you automatically are not going to become obese, right? So definitely take care of your leptin and ghrelin levels. Okay, so that's why when you're dieting, if you're compromising on your sleep, you don't lose weight. When you go for a diet, they also say your quality of sleep, quantity of sleep is very, very important because your leptin and ghrelin level balance has to be there. Otherwise, your satiety hormone is going to be lesser and your feeding hormone is going to be more. So you automatically overeat, right? Remember, both these hormones work on your adiponectin and your adipocytes. When you're doing so much of dieting and physical activity, you are trying to burn the really resistant fat from your abdomen, your back, and other places. Now, these things have to be burnt. So, please have these hormones at a normal level. Okay. Bhavna, if I get a terrifying dream during my sleep, I'm not able to pursue my sleep however I try. What should I do? The same thing that I told earlier. This terrifying dream, what is it? Have you ever spoken about this terrifying dream to somebody? Try to speak it out, right? There is something that is affecting at your subconscious level, which is coming up here. There is something which has triggered this terrifying dream, right? That has to go out. Talk it out. That's why I said a psychologist, where you can talk it out, you talk it out to them. They help you to ward off all these things and help you to overcome this at your subconscious level. Okay? Aravind, ma'am, to treat insomnia due to depression. That's a very good question. See, for treating depression, they give so many SRRIs. Okay? These things quietens your brain but don't put you to sleep. So that's why they do a titration of pills that put you to sleep and your SRRI levels. Number two, that SRRI drugs, when you take, the time of those drugs are also very specific. You're not supposed to change those timings, right? So please take the instructions of the psychiatrist who has given these prescriptions, how it has to be taken, right? This is about medication. Number two, medication for these patients. If they are not able to meditate, they say that even a schizophrenic patient is not supposed to sit for meditation. Okay, because already they can think erratically. At this stage, their thoughts can go haywire. So in these conditions, guided meditation or guided imagery, which helps them to calm them and then go in for a sleep. Or a soothing music also helps them to go for a sleep. These things could be tried as an adjunct along with the medication that the psychiatrist has prescribed. They are not a replacement for depression treatment. Okay. Rohini, are dreams indicator of good quality of sleep? No, because you dream predominantly and you remember those dreams nicely when you're in your REM stage of sleep. REM stage of sleep is not a good sleep at all. Okay, but REM has so much of importance. So REM stage of sleep should be there as part of your sleep, but it should not be more, right? So do not have too much of dreams. That doesn't mean that you had a good night's sleep. Aishwarya, I usually sleep late, but why is it when we fall asleep soon, like 9 or 10 a.m., then we wake up at 2 or 3 a.m.? You are sleep deprived. You are having insomnia. I'm not telling you sleep deprived, you're having insomnia, you're having lack of sleep. If you're going to sleep by 9 and wake up by 2, that means you have effectively had only 5 or 6 hours of sleep, right? So better have at least 8 hours of sleep. That is ideal for sleeping. What wakes you up at 2 to 3? Check that out, okay? And sleep again, avoiding that process. Subiksha, how to adjust our sleep timing while while staying in hostel when others are awake during night. Ideally, um, when I was at Harvard a short time, I just saw what all they do. There are beautiful things that they do to identify who could be roommates. Who could be roommates? They have identified people having very similar lifestyle, people having similar likings, people having very similar life setup, family setups, and other things. So these things automatically makes your roommate also be a person who is not a night owl, sleep along with you, right? Now we don't follow such things here because they are small things, but they mean a lot, like how you have said. If possible, tell your roommate to use a table lamp, not put the room light. If that is not accepted, you have that iPads, use that and then go to sleep. Put that iPad and listen to some soft music so that even if she's going to read aloud when she's sleeping, that distraction is not going to be there. This is all I can say. The best thing is speak with your friend so that she understands your sleep time. She can sleep outside your room. So she can read outside your room. You can't sleep outside your room, right? There is a reading room in every hostel, so they can go read there. Hari Prashad, eating full tummy causing me to sleep. No. Eating full tummy causes you to sleep in a sitting posture. That is your postprandial alkaline tide, which makes you sleep, right? But that will not last for long. It's only that 1:15 to 2:15 physiology class on Wednesday, you feel very sleepy because it's after your lunch break, right? It's because your postprandial alkaline tide. Okay? But a heavy stomach automatically makes your diaphragm movement reduced. So that does not give you a good quality of sleep. So that's why I said sleep 2 hours after your dinner time. Okay? Nitin, how does the retention of memories from dreams vary? I've noticed that lucid dreams seem like they last longer. It is because we retain the info we perceive in it much better. There are some dreams which I can tell it out so clearly. There are some dreams which is very vague, right? There's another question. Do dreams have color? I have seen color in dreams. There are studies which have said that you do see colors in your dreams as well, right? So that means you can see dreams with so much of clarity. But it all depends. What is the time of your sleep is this dream? We get a dream at 2 p.m., 2 a.m. We get a dream at 4 a.m. also. Which dream do you think you will remember? The dream at 4 a.m. you remember more because at that time, if you see your sleep hypnogram, from this level, it has become a longer REM phase. Okay. So the dream was also longer. So more info or nitty gritty you're able to remember about the dream. And you wake up after that. So you recall is also better with that dream. Okay. But the earlier dream, let's take, I have had a REM sleep. I've had a dream. I went in for my slow wave sleep and I woke up with my slow wave sleep. I will not remember my dream, right? So, this is another thing. Which phase did you wake up to make you remember your dream? Okay. And which dream do you want to recall? The dream you had in your previous REM cycles or the dream which you had as the last REM cycle? The last REM cycle dream is better recalled than the one that you had the previous REM cycle. Okay, Nitin, I think you yourself have answered. Is it more related to the stage of sleep we are in at the moment? The stage of sleep you wake up from your sleep. Okay, Hari Prashant, you told to keep our phones in silent when we have some emergency call or anything important. Hari, What could be the emergency call for you? If you're a hostel student, it is an emergency call from home and you have kept your phone in vibration mode. Your parents or your whomever you have given as your local guardian knows the hostel number. They will call that number. It's your home. Every home has a landline. If your mobile phone doesn't pick, they will call a landline, and landline does not have a silent mode option. Okay, so that's we keep giving excuses. Let's stop giving excuses and change our habits for our own betterment, right? Don't take it harsh. I'm just telling because even I do the same thing. Shruti Raji, could you talk about the relation between migraine and sleep? A person who has migraine cannot sleep. Okay, I think that is very clear. A person who has very high sleep debt, that means for a number of days he has not had a good quality of sleep, that person is more prone for having migraine attacks, right? Because this migraine, one of the cause is your dilatation of your cerebral vessels. When you're awake, alert, and your sleep is compromised, where have you given time for your blood vessels in your brain to to have a lesser dilatation, right? Their diameter have all along been big because you've been giving them so much of activity. So I am a migraine patient and I am compromising on my sleep quality. My migraine attacks will be more. How are dreams formed? There is a couple of theories which say how we get the dreams. That's because we have the EEG waves which are getting synchronized and desynchronized during our sleep. The dipole moment of the cortical neurons are changed because of the subcortical structures interacting with them, okay, which causing desynchronization, synchronization of this EEG wave. Now, these subcortical structure, when I say subcortical structure, it is predominantly your limbic system, hypothalamus, and also your basal ganglia. That's why even in Parkinson's disease, your sleep is affected. Okay. So now these subcortical structure send some signals towards your cortex. Okay. Now when they are sending these signals towards your cortex, it is making so many things. It could be a visual cue, which should be an auditory cue, or it should be your frontal cortex getting stimulated as well. Okay. So now these things are what is making you see something, imagine something, visualize yourself, your 3D orientation, or hear something also. Remember, these also happen in schizophrenia. Okay, but this is happening during sleep, which makes you go into dream so many things. Okay, I have one question from Vishalini. Ma'am, after a period of 1 hour of exercise and we feel like sleeping and not able to study, any remedies? If you are a student who goes to the gym regularly, there are a few things which your gym instructor tells you. At least 45 minutes after your exercise, do not have your food because you have worked a lot, your blood sugar level has come down so much, you will overeat. Okay, so after this 45 minutes, they say drink water. Okay, because you would have dehydrated, drink water. But 45 minutes after that, you have your food. It could be morning breakfast or it could be a lunch, it could be dinner, whichever time you're doing your exercise. Okay. After your food, have 2 hours before you go to sleep. Right. So that means immediately after you do your exercise, oh my God, today was a hectic exercise. My body aches. Don't fall flat on the bed. Okay. Small lifestyle modification. Just make it. Everything is you talk to yourself. You are talking to your brain. You're talking to your mind. Tell it. Now, I've done my exercise. That was for reducing my weight. If I'm going to hit the bed, I'm going to not lose my weight at all, right? Remember, you have not had your dinner, but you're hitting the bed. You will not lose weight. I tell you, you will not lose weight. Okay, because your hunger hormone is higher now. Naveen, can we sleep late at night? You are going to sleep at 10:30, max 11 p.m. Okay, don't shift it to tomorrow morning to sleep for today. Sleep for today tonight itself, right? Lily, is bedwetting normal among adulthood? No, bedwetting is not normal among adults. If there is bedwetting, number one, that clearly shows my sphincters are not working properly, right? My sphincters, though my brain is less active, my brain has an inhibitory control on the sphincter. They don't permit it to dilate. They don't permit it to relax. Okay. It's always under the tonic stimulation of my cortex. That's why none of us need a diaper in an adult till we are that 1.5 years when our bladder is not under our cortical control. In our sleep, if that is happening, that means my bladder has got filled and the bladder is contracting. So the spinal reflex is lost. Check for so many conditions as simple as it could be vitamin B12 deficiency, okay, or it could be B12 and folic acid deficiency, because this is very common in vegetarian adults because you don't have enough B12 in most of the diet that you take. The next thing, check for any syphilis infection or anything that could affect on my nerves, right? Any of these things could be a cause if an adult is wetting the bed. I'm not telling an old age. I'm telling an adult means somebody between 25 to 55 years. If he wets the bed, think of all these conditions. Okay. I have a question from Ari. Is it advisable to get up and out of bed if one is unable to sleep immediately? Wonderful question. There is something called a sleep latency. Your sleep latency is from the time, have a sleep diary. In the sleep diary, start to write what time you slept, went to bed, what time did you actually go to sleep. It could be arbitrary. In 10 minutes I slept, in 5 minutes I slept, in 15 minutes I slept. Okay, write that. When did you wake up? In between your sleep, what all times you woke up and for what? Keep noting all these things. And finally, how do you feel after you wake up? Have this in your sleep diary, right? Now watch. I hit my bed at 9:30. In 10 minutes, I was in another world. That's fantastic. You're a blessed soul. This is called a sleep latency. From the time of hitting the bed to falling asleep should be maximum 15 minutes. If not, please get off the bed, listen to some soft music, read some book. When I say read some book, let it be a novel, no thriller or nothing like that. Read something like that and then go to bed, right? Do not keep rolling on the bed if you're not getting the sleep. Hari Prasad, is there any ancient method followed by our ancestors to improve sleep? Do you know what time they had the dinner? They had the dinner before 7 o'clock. There was no light in the house except for those lamps. There was no TV, no radio, nothing. There was no AC also. There was no spring mattress or anything, but they slept. Slept really, really well. And the amount of physical activity that they did was so much. I'm not telling a farmer or a working class. Anybody did a lot of work. Nobody used an elevator to climb. They used to use only foot, the stairway. When I need to go to a shop nearby, they did not take a bike, they used to walk. For them, minimum walk would be 2 kilometers. If a shop is at 2 kilometers, we immediately take a bike. They used to walk. There was enough physical activity. They never overate. It was always half stomach, never full tummy. As somebody put it across, no full tummy. It's always half tummy. What needs to be taken at night? They were very, very clear that the night, the supper, or what we call as the dinner, has to be a very light meal. It cannot be a very heavy meal, and sleep by 9, not later than 9. And they woke up by 4 a.m. Their bio clock was perfect. There was no alarm, nothing. They could do it. So first important thing was no sensory cues to keep making them awake for a long period of time. We can still do it. We did, right? When there was Vardha or the cyclone or the flood that we had, we didn't have anything else. Did we not sleep on time? We spoke nicely with our family and we slept on time. We can do it. We have become slaves to all these technologies now. Mohammed, ma'am, can we split the number of hours we sleep, like 4 hours? We have finished this already. No, do not shift. Do not. Okay, it's a continuous sleep. Anjali, what could be the cause of sleep apnea and sleep bruxism? Sleep apnea, I have already said a little bit about snoring when I said that's called as obstructive sleep apnea, where your anatomy is making the obstruction for the airway. That is one cause where I have hypopnea or apnea. Okay, hypopnea is lesser than what I normally take in. Apnea is complete cessation of airflow. Okay, there is the one more cause for sleep apnea, which is called a central sleep apnea. That is from your brain, which is not stimulating my respiratory muscles to move. Okay, so that causes another thing. No chest movement is seen in them. In obstructive sleep apnea, you see chest movement but no airflow. But in central sleep apnea, you don't see the chest movement also when you're seeing no airflow. That's called as central sleep apnea. Okay. The treatment for both are different, right? So that's a totally a complete set of things which we need to take it. Okay, so it will be too much if I'm going to take that part now. If I'm not having any questions, I will come to that again. Sleep bruxism. Bruxism is your teeth grinding that you do when you're sleeping. It's very, very common in children. One of the cause that they say children having bruxism is some worm infestation also stimulates bruxism. Okay? Bruxism is also seen in some of the conditions where there is an underlying neurological causes. There are some splints that are given for bruxism. When we go to the dentist, they can give us some things which are put so that, because in the bruxism, the teeth grinding, the teeth sharpness are also lost. So those things, appliances can be used to avoid bruxism. Why somnambulance is common in male? Unfortunately, most of the sleep disorders are very common in male. Okay? Research is now coming to show that most of these sleep disorders are X-linked. That could be one of the cause. Number two, like sleep apnea, testosterone is one of the cause. Okay, so that links them together, having male having most of these problems. Muskan, is it true that our brain recognizes everything we learn during sleep? Also, it is like better the sleep, better the retaining power. Yes, that's why I said before your exam, definitely sleep properly. I'll just give you a small thing. The very first time you learned swimming, the very first time you learned cycling or playing the keyboard, playing the guitar, or any of these things, Have you played all those things when you're sleeping? I'm sure you will remember that you have done everything during your sleep, right? That actually it is that's what I said. When you're sleeping, especially in your REM stage of sleep, your consolidation of memory happens. Whatever you learned new, it is like uh, chewing the cud that you see in the cattle. That goes in again, right? Replay what you read before, replay what motor skill that you did before. So that becomes so nice. Tomorrow morning, you'll get a simple solution for the way that you did that motor activity. Tomorrow morning, you will remember that activity much better. So that's why sleep is very, very good. And sleep calms your brain. So automatically, your cognition is very good there. Naveen, Naveen, this is very common in boys nowadays. Sleeping today and waking up today. Please sleep tonight and wake up tomorrow morning. Please change that. Okay? Only if you change that, you will get refreshed. You will get a good quality sleep. Okay? Anjali, why do infants have more REM than NREM sleep? Actually, infant have the polycyclic sleep, okay, or the polyphasic sleep a lot. Okay, in their sleep, this cycle is very, very important because there is large amount of growth hormone that is produced. That's why you don't wake up. Initially, they used to say 2 hour breastfeed your child. Then they have started to say no. Let it be a demand feed. Let the child wake up, cry for the milk, then you feed the infant. That's because during the sleep, there is so much of growth hormone that is being produced, which is required for the child's growth. Okay, you will actually see longer sleep period in premature baby rather than a child delivered at term. Okay, that's because there is so much of growth hormone and other hormone, especially cortisol and other things, have to be produced for maturation of the lung and the liver hormone, liver enzymes as well. Okay, so growth hormone and the liver function have to be there normally. We need to have a good sleep in the infant. Naveen, ma'am, at night, what should be time interval between sleep and dinner? Naveen, did you sleep in the initial part of my discussion? It's 2 hours. Okay, 2 hours. Let it be the time between your dinner and your sleep time. Watch what you eat as well. No oily food, no spicy food. Okay, okay. Rohin, do the things that we see or hear or talk about before we sleep have a negative impact on the majority of us? Or does it vary from individual to individual? See, it all depends. We sit in all the classes. Do everything enter our head? Aren't we selective in that? The same thing applies in this also. Everybody who is sitting is not listening, is only hearing. Okay, there is a difference between the two. Hearing is a physiological process only at the ear going to the cortex. Listening it also goes to your intellect. Okay, you analyze it, you give a meaning to it. In fact, what you're listening, you even give a visual imagery to it, right? So such people, these things, what they hear, what they see, what they talk, have an impact on their sleep. Somebody who's just listening, nodding their head just like that, they appear listening, right? But they are only pretending to listen. They will not have the impact at all. It all depends on how much I make this listening go into my subconscious state. Okay. Naveen, what is the difference between sleep, sedation, coma? Actually, what happens to the brain neuron in all these conditions? In fact, sleep and coma, there is only one difference. In sleep, I wake up with an appropriate sensory stimuli. In coma, even with any sensory stimuli, I don't wake up. Okay. In sleep, it is my reticular activating system which is not sending signals to the cortex, which is the primary thing which is making my cortex go for sleep, right? In coma, this connection is completely lost. In sleep, it is physiologically lost. In coma, it is organically lost. That's why the cortex is not, I'm sure you remember, all your ascending tracts and all your descending tracts give a, a tract to your reticular formation in your pons and your medulla. Now, this getting sensory cue as well as the motor signal makes your reticular formation always active, which keeps again your cortex active. As long as that is active, I can't sleep. This is organically cut in coma, so my cortex is not happening. In sedation, or even if I say anesthetics, they act at this level, stopping my RAS sending signals to the cortex. So my cortex is no more active and I feel sleepy, right? That's sedation. Shalini, ma'am, is it true eating pongal and other carb food induces sleep, especially during morning hours? Okay, they do say yes, because pongal especially. What is pongal? It's made up of rice and dal. It's not the rice which is doing it. It is the dal of your pongal which is doing it because it's protein, which is making more of your HCl being produced. Automatically, you getting an alkaline type and then going in for your sleep. Right? That's it for now. Okay. You can ask me, some people say that if you take curd rice, you feel very sleepy. That's again because of the content of your curd rice, which promotes sleep. Yes, curd is again a sleep enhancer. Renuka, ma'am, do people with poor sleep have a high risk of developing Alzheimer's disease at an early age? One thing I can say, poor quality of sleep compromises us to most of the neurological disorders. In addition, if I have a predisposition for some of the neurological condition, I have a family history of Alzheimer's. Now, my father got it at the age of 80. I am also sleep compromised. I might get it at the age of 55 itself. Okay? Next, Naveen. In home, we won't do breakfast. Is it good? Okay, this is something beyond our sleep. Break fast. The name itself still break the fast. Because your last food that went in was at 8 p.m. 8 a.m. At least you had something. Okay. Now they have said that this intermittent fasting, 12 to 14 hours of intermittent fasting is what we were practicing in our old age. Okay. In our olden times, our parents or our grandparents were following that. That was actually good, it seems. Now they are telling intermittent fasting is good because you have given 12 to 13 hours that you were fasting, at least 10 hours in it, pancreas was resting. It prevents beta cell over functioning. So that helps you not to develop diabetes. Okay, so that is one thing that they say it is really good. But I would say not more than that. Okay, don't say that you had your dinner at 8 p.m. and your lunch at 12 noon. That's too long a time. Please have something. It could be as simple as just some kanji at least. Okay, or at least even a fruit. Vicky, ma'am, sleeping continuously for 8 hours is better, or 6 hours continuously and sleep for a while in the afternoon, which is better? 6 hours of good sleep, uninterrupted sleep, is actually enough. You don't need to again sleep in the afternoon. Okay, it is 6 to 8 hours. Ideally, 7 to 8 hours is sufficient, but don't break your sleep. Like I will do 5 hours now, 3 hours later. Don't do that. Hari Prashant, my sister talks during her sleep. It's just a curious question. What language does she talk? Is it comprehensible? Sometimes it is non-comprehensible. Okay. I hope all of you have seen Chennai Express where Deepika Padukone screams something, right? Non-comprehensible. Okay. Some people have this talking. This is one type of sleep disorder movement, which is called. Okay. But it should not be like enacting totally. Then you need to consult a sleep specialist. Okay? Otherwise, just don't worry, it will stop. Just only thing, if they get up, sit up and talk, they'll put them to sleep. Though you don't need to give a meaning for what they talk. Even if you record and show it to them next day, they will not believe that they spoke. Lily, ma'am, can you say the relationship between sleep and our immune system? Very, very good question. That's one of the reasons why they say sleep is very good. Because when you sleep well, your cortisol level is also low. Remember, your cortisol suppresses your immune system. No, I'm not having cortisol. My immune system is not suppressed. I am not stressed at all. Okay. So, good sleep makes us have a very good immunity as well. Okay. Number two, when we are having a good sleep, our free radicals that are generated in our body are quenched. Okay, so you don't have free radical induced damages happening also. So your each cell of your body becomes hale and healthy, and they are not susceptible to diseases or damage of the cell membrane as well. Okay, so these things makes you more healthier. In fact, good sleep makes you healthy. Good sleep makes you younger as well. I think I've answered all the questions. Any more questions? If not, if no more questions, if we have time, I'm just going to question on sleep apnea that was asked by somebody. I said I'll go into the treatment later. If it is obstructive sleep apnea, which I said there could be obstruction in the different pathways, airway, okay? In this pathway, what happens is that this pathway, surgically, you can correct this pathway, okay? It could be my adenoids, which is blocking. I can correct that, okay? Tonsils blocking, I can correct that. Septal deviation, I can correct that, okay? So these things I can keep doing it. If not, I can use some of the appliances to correct. Some of the appliances is, these appliances help us to keep our airway open. So they help in making the airway not to collapse when we are going in to our sleep and the muscle tone is lost. Okay. So that is another way of doing it. The other way is using some appliances like which they just keep over the mouth, nostrils and the mouth, or only the nostrils at least, connected to a positive pressure equipment, which we call as CPAP, continuous positive airway pressure. Okay, so that means it is going to prevent my airway from collapsing. It will keep my airway always patent. So my airway is not collapsing. So air will go in very easily and it will happen. Okay. There are some surgical treatment as well. One of it could be I can have like a pacemaker for my hypoglossal nerve so that the airway which gets collapsed because of my hypoglossal nerve can be corrected. Okay. If it is central sleep apnea, you have to treat the cause there. What is the cause there? Very difficult to treat central sleep apnea alone. Okay. My mother won't get sleep at night. Any advice? I've given you some of the advices, your time of sleep, time of dinner. What do you have at your dinner? Okay. What do you see before you go to bed? Warm milk, or simple as gasa gasa or something in your milk can put you to sleep. Ma'am, is there any benefit of sleeping in the afternoon? How old are you? If you are anything between till 10 years, your afternoon sleep might be of some use to you. Otherwise, it's not. But I would say a power nap might definitely be of some use to you. Okay. Snaha, Somal Q is an indication definitely of your underlying some problems. You will have to address that. Okay. Uh, Hari, I'm having many who are undergrad MBBS student, so I'm not going into that process now. Okay. Any other questions? Any other question? Thank you. I was really thinking, will I have enough questions till 8 p.m.? And you really made me speak with you a lot. And I did enjoy speaking with you. I actually had enough of slides, but you asked most of the questions that I had on my slides. I think this is the first time I'm doing something like this, asking questions, answering to questions from students totally, completely for close to 2 hours. And I think I enjoyed it. I hope you enjoyed. Which position is better, either prone position or supine? I think this was asked actually. Okay, ideally a lateral position is better, preferably a left lateral. But if you're using a contour mattress, please go only for a supine position. Depending on any other underlying problem, respiratory problem or gastric problem, please identify which problem suits you better. Let's take as simple as somebody who has acidity. Please do not sleep on the left lateral portion side at all. Okay. Ma'am, when I meditate, I tend to sleep soon. Is that normal? Yes. Everybody who meditates initially, you are a beginner in meditation, you will sleep. Right? It's like as you meditate, the sleep is hanging right over the person who is ready to take it, and it will take on them immediately. Okay. So you will sleep, but please wake up from the sleep and go back to your meditation again. Okay, keep trying. Wonderful feel you get after you wake up, much better than what you feel after you sleep. Tarun, how was your sleep pattern during your teen and college part of your life, ma'am? God's grace. I sleep early and I wake up early. Thanks to my father, he never allowed us to read after 10 p.m. We have to wake up at 4 a.m. if we have left anything to study. But 10 p.m. is the max. I've always slept. 9:30 is my bed night. Good night sleep time. So I sleep early and I wake up by 4 a.m. or max is 4:30. So try that. I am seeing your Bhagavad Gita. Nice. I see your roll number also. 17. Ma'am, I sleep 8 hours a day, but still after exercise I sleep. After breakfast I sleep. So can you please tell me? After exercise, all of us feel tired, but just pat yourself and say, Geeta, you've done a wonderful exercise today. That exercise should work on you. So don't sleep. Let's just have a good bath and then start to work. Have a bath with cold water and not a warm water. If you go have a bath with your warm water, you will definitely feel sleepy. That's one of the best way to go to sleep. Have a nice warm water, not a hot water. You will sleep well. Rise, ma'am, I have a habit of drinking almost half a bottle of water before sleeping, or I feel thirsty. What should I do? Please, half a bottle of water, roughly 500 ml of water. That means your sleep will definitely wake you up, or your bladder will wake you up. Okay. I tell you, your sleep is quenched with just 3 mouth of water. 3 mouth of water quenches your sleep. You have seen many of the athletes, they don't fill their tummy with water. They just drink water, keep the water in their mouth, gargle it, spit it out. Because if my stomach is going to be overfilled, I can't run well. That is enough, because your oral mucosa can make your thirst center full it to say that thirst is quenched. So your thirst is not quenched with till you sip the 450 ml of water, right? It is over with your 100 ml of water itself. Remaining thing is your feel to drink more. So try that, you will feel better. Okay. Any more questions? I should say thank you, girls, a lot. Thank you, girls. I should say thank you, students, a lot. I think it's always a pleasure to be with my students from Chettinad. I really enjoyed speaking with you. And some of the names when I saw, it just ringed me the familiarity bell. Some of them were my mentees too. Okay. Wish you all a best wishes. I should say this COVID has given so much that we can change ourselves. The first change that we can make is in ourselves is the way we think, the way we live. Let's change both to the better of us and also better of others around us. It will be really good for each one of us to make this world the best place for each one of us. Thank you very much. Muskan, I'm ending the stream now. Can I? Just my last word to everybody. As the flyer said, we sleep 1/3 of our day. The quality of this 1/3 makes how much is our 2/3 going to be used best. So have a good sleep for 8 hours tonight. Let's start it from today. Good night, everyone. Bye.